Every organization has the opportunity to have defining moments. And oftentimes they're fun and exciting. Sometimes they are hard and scary. I think we have a combination of that happening right now. As all of you know, we are beginning to see real evidence that COVID-19, the novel coronavirus, has taken root in the United States, and activity is heating up here in Utah. We, as an organization, are really ready to take care of these patients and take care of our communities. I had the opportunity with Sue Roble yesterday to go to the EPU down to Intermountain Medical Center, and boy, was I proud of the work that I saw being done down there. Highly motivated caregivers, smart, thoughtful, on point, selfless, and really eager to serve each other and to serve the patients in the community. This is a fast-moving, rapidly evolving situation, and we don't know all the answers yet. But what we do know is we are always going to put our patients first, and we are always going to put our caregivers first, and that we're going to do absolutely everything we can to serve both of those groups as thoroughly and thoughtfully as possible. We're opening a dialogue with you today. We are going to share with you the situation as it exists right now, and we're going to anticipate that we're going to get an opportunity to speak with you on a regular basis over the next weeks and months, because this is going to be a marathon, not a sprint. I'm completely confident that whatever pops up, Intermountain will have a coordinated, thoughtful, and team-oriented response. And even if tough things happen, we're going to look for good to come from this so that we can serve better in the future. You're going to hear from Blair Kent now, administrator at Intermountain Medical Center, who's going to bring you up to speed on the operational implications of what's going on right now and our preparedness. So Blair?
Thanks, Mark. As everyone's aware, we had our patient admitted last Friday, but our preparation for that moment didn't start last week. We had almost 5 years of advanced preparation. We had taken advantage many years ago. Intermountain was very thoughtful and diligent in trying to create a vision of how do we treat people that have unique situations, conditions. So as this EPU is designed and built, there were guiding principles that I still think are fundamental to who we are. We were focused on safety of the patients, our caregivers and community, and the capacity to provide quality care regardless of this unique and freestanding unit. So about 4 years ago, the unit was completed. It was designed in an incredible way to accommodate situations just like this. We were able to have great physician leadership and clinical leadership with our nurses. So we've been able to have physicians and nurses trained well in advance. So luckily and strategically, that when we got the notification, everyone sprung into action in a really fluid manner. Our engineering department, who has had stewardship over the past 4 years, were able to immediately step in, and the facility they've been able to maintain over the past 4 years was readily available. We were able to turn everything on and start getting to go in preparation for the receiving of this patient with minor tweaks and minor changes. Then immediately following that, we were able to mobilize all of the unique clinical aspects from our nursing to pharmacy, and having them come together to physically be in this unit and start identifying what's it going to look like and feel like when our patient's here. What are the handoffs? What are the things and the resources we need? So over the course of that time, we were able to set that unit up fairly quickly and thoroughly. Our commitment, which we've been for years in doing our daily safety huddles, we anticipated things really well. Physically, we've had to tweak things, maybe little things here and there from a communication standpoint. Something as maybe insignificant as a TV, the number of stations, to how we communicate through the glass, and then some things like food services. How do we deliver and where do we deliver the food? So overall, it has been a great success. The caregivers are well trained. We are well stocked and supplied to do exactly what we're doing. This isn't a unique challenge for us, nor is it something that we're not prepared for. This has been years in the preparing and planning, and now we're doing what we're trained to do. So the caregivers are excited. There is an energy with the nurses there, and through our huddle process, we're learning on a daily basis. So the patient's at the right place with the right time, with the right people, and at the right time. So, Dr. Phillips.
So as Blair said, we've had a really great opportunity in a very planned fashion to introduce our workforce and our health system to COVID-19. And the situation is changing very, very fast. We're learning kind of on the fly as information comes in, both from the Centers for Disease Control and Prevention and from the Utah Department of Health. And so they're updating guidance, clinical standards, and we are keeping pace with them to be sure that the practice that we have in our EDs and our ICUs across our system, wherever a patient comes, we're ready to provide what is the standard today. I'll also share with you that the standard today may not be the standard tomorrow or 2 days from now. We're learning, if you've kept an eye on the news, it's an hour goes by or 7 o'clock tonight, we'll know something different. And we're really doing our best to keep pace with that. What I would like you all to know is that your leaders, your managers are putting your safety as a caregiver first. We're caring about you so that you can care for our patients, for your families, and your communities. Interestingly, initially, as you've probably seen in the news, we've been able to identify risk, and we'll talk about that, others here in a moment, through where you've been, right? Where's your travel? Have you been in China? Have you been in Italy? And what we're finding over the weekend, for example, is that that's only getting us part of the way there, right? So as we've seen what's happened in Washington State, and each day I think we'll see something different. So travel history is helping us, but that's probably not going to last for very long. We're going to find ourselves with direct community spread, and that's some of what we're seeing in Washington State now, and that's going to make it a little harder to know who's at risk. And so bear with us. We're going to give you every guidance that is available to us, and we're going to kind of take a ride here that the country hasn't been through and the world hasn't been through in a while. We are learning. We're a learning organization. We are caring for you and our patients, and as the guidance changes, we're present for you. Please know that we have a website that's available internally as well. The CDC and the Utah Department of Health have sites for you to go out and care for yourself, as well as we're going to update for you as caregivers what we know in the moment. And so please use that. And the communications team is going to stay all over this. And as Marc said, this will be a continuing dialogue, both with things like this as well as written material that we'll have available for you. So we're informed, we're staying connected so that we can help you serve our patients. I'm going to turn it over to Eddie Stenehjem so he can share a little bit about how we can be members of the community and what we need to do.
Thanks, Shannon, and thank you all for being here. As we know, COVID-19 is caused by a coronavirus. The coronavirus causes the common cold. We've all had coronaviruses in this room. And the good news is we know a lot about the science of coronaviruses, but this is a new coronavirus. It's novel. And we're learning every day about the transmission of this virus. We will learn more in the weeks and days that come as tests become available, as we start testing our community and communities in Washington and Oregon start testing more broadly. And we will be able to give that information to you and to our caregivers and to our patients and communities. Right now, there is no treatment aside from supportive care for this infection. Fortunately, the vast majority of people that get this infection do quite well. We want to ensure that we can care for those patients, though, that don't do well. Vaccine studies are currently ongoing and enrolling, in addition to treatment studies for randomized control trials are certainly ongoing as well. Intermountain will be involved as we can in those and keep you updated on current treatments that we can provide. Like cold and flu viruses, this virus transmits on droplets, infected droplets that are generated when we cough and we sneeze. The way people become infected is those droplets are directly inserted to somebody's eyes, nose, or mouth during a cough or a sneeze. Otherwise, they can cough and it can land on an inanimate object, a counter, a desk, a kitchen appliance, and then we can touch that, and then we take that and we put it into our face and we can get infected that way. So there's many ways we can prevent community transmission, simple things that we can do not only in our hospitals, but also in our communities. The first and foremost is easy. It's hand washing. We want to ensure that we are washing our hands consistently. And so when we touch those infected areas, we are disinfecting our hands by hand washing. And you will see all the leaders be doing that routinely, and this is the new normal to be doing this often. In addition, we want to avoid touching our face. It's easy to say, but very hard to do. But avoid touching one's eyes, nose, and mouth to really decrease that transmission of the more common things that are happening right now in Utah, which include influenza. We want to make sure that people that when they are sick and coughing and sneezing, we're coughing into our elbow, we're coughing into a tissue, we're avoiding infecting our environment as much as we can. We also want to make sure we clean frequently in the environment, using disinfectants not only in our home, but also at our workplace and in acute care settings as well. You may have seen some coverage about a shortage of masks in different environments in different communities. Right now in Utah, and definitely within Intermountain, we do not have a shortage of masks. We have them aplenty. But keep in mind, we don't recommend wearing masks in the community. We are not at that point yet. In fact, there is some recent data to suggest that there's potentially higher risk for people that wear masks. If you're touching the masks and manipulating the mask, you're also touching your face. So we don't recommend that at this time. In addition, as a precautionary method, we would recommend using non-handshake methods to greet one another. We can do fist bumps, we can do elbow smashes, or we can just greet each other with a simple hello. It's a precautionary method, but that's completely acceptable here within Intermountain as leaders and also as caregivers. Bottom line is we're here to protect the community, our caregivers, and our patients, and we'll keep you updated as we go. Let's turn it over to Rebekah.
Thanks, Eddie. So there's some things that each of us can do right now to make sure that we're ready for what's coming our way. The first thing is we should be prepared at home. So keep basic supplies like food, your medicines, vitamins, essential items on stock at home. Be ready for that. Additionally, we want to make sure that everyone in your family and your relatives who live with you know how to do things like wash your hands well, wash them appropriately, avoid touching your face. Many of the things that Eddie just shared with us today are the same things that our family and our children also need to be aware of. On top of that, many of us have questions about what to do if you feel sick. So the first thing is that it's winter flu season, and there's many respiratory illnesses that are common and available at this time and in our community. So if you are feeling ill, please make sure that you stay home from work so that you can care for yourself. If you have questions or you have concerns about COVID-19, here are the steps that you should take. So the first one is please go to the Intermountain webpage. The website that is set up right now is being updated multiple times per day. And you should be able to get many of your questions answered there. If you're not finding the answers to your questions and you think you might need care, it's very important that you call first before going to a site for care. If you think you have significant symptoms and you're afraid or you're concerned that you may need COVID testing, you still need to call first. As a reminder, if you have mild symptoms, you stay home and just do the care you would normally do for yourself. At this time, only people who have traveled to an area where there is coronavirus is currently prevalent or active, or if you have had confirmed contact with a patient that is positive confirmed case of coronavirus, COVID-19, those are the two criteria that are necessary to be met before you would be eligible for testing, in addition to the symptoms that you may be experiencing. So if you are ill and you have not met either of those two risk factors at this time, you should get care as you normally would, with your primary care provider, with Connect Care, or if needed, with an Instacare. If you have significant symptoms, high fever, significant cough, shortness of breath, or trouble breathing, and you have traveled to a place where coronavirus is active or prevalent, or you have had contact with a confirmed coronavirus COVID-19 patient, you need to call Connect Care immediately. At any time, if you have urgent life-threatening situation or symptoms, please call 911.
We should do a fist bump or elbow bump. There we go. Thank you. So bottom line is we're doing the best we can. I think the team is, and when I talk about the team, I mean the whole enterprise is doing a spectacular job. We have the right people, the right training, and as you heard earlier, we're a learning organization. We're going to be just fine. I think we're also going to learn a lot about ourselves, personally and professionally, as we go through this process. And that is one of the good things that can come out of a very tough situation. As you heard, we don't have all the answers. As we learn, we're going to share. We respect you, and we need your input. And you'll see some contact information come up on the screen. Please use that. We want to answer your questions, and we want to do that in real time. In addition to the no more handshakes and probably maybe hugging was never okay, Heather, I don't know. HR compliant hugs only, but maybe this isn't the time to do that at work. I think hand hygiene, careful with our handshakes, and then watch for us to be really thoughtful about travel, and we're going to ask you to be thoughtful about your travel for work as well. Really asking yourself whether a meeting can happen over a VTC, from home, over the phone. If you need to travel, we're not putting any bans on that, but we're asking you to be really careful and thoughtful. We have a couple of very large meetings that are scheduled. Our Intermountain leadership team and our management leadership team meetings are on the calendar. We're going to morph those. More to come over the next couple of days. We want to send all the right messages, but also do all the right things that keep people safe. And so the curriculum for those meetings will change, and probably the locations and constellation of the people who are at those meetings will change. In the end, I just want to say how proud I am of all of you. I get to come to work every day and work with the most thoughtful, mission-oriented, caring people that I could ever imagine. And I think this is an opportunity for us to take care of our patients, but to take care of each other and to feel that connection to purpose that I think motivates all of us to be part of Intermountain. So thank you for your time and attention. Look for more communications to come. And please, if you have questions, use the resources available and ask them, and you'll get prompt answers. Thank you very much.